So there's one last question. With your experience, I want to know how was the pre or post-op of the patient, and how was the entire journey according to your patient's testimonial perspective?
Yeah, so it's a very exciting for the patient also, because he knows that now a newer technology is being used for my knee replacement surgery, and if he understands the surgical techniques and the surgical steps, then the involvement of the patient is also good. We usually tend to do a pre-operative assessment, clinical examination of the patient. We tend to do X-rays of the patient for the pre-operative planning. We do that CT scan. So the CT scan of the entire leg is done, and these CT images are fed to the robotic software, where the calculations are done prior to the surgery. We usually tend to do these calculations on just before the day of surgery, and that is how the planning of the implant fitting, the sizing of the implant. And I can tell you that we can have personalized alignment. If a patient has lived his life for 20 years and he's walking with a little slight bend in his knee joint, I can't make it completely straight, because then it is going to make him a little dishappy. So with robotic knee replacement, we can achieve personalized alignment for the knee replacement, and these personalized alignment have shown in recent trends have shown to have better outcomes in terms of patient satisfaction. So once this part is done, the main part of the surgery day comes, where the patient is prepared according to a standard knee replacement. Only thing added that we do is we spend some time in feeding that knee information to the robot, which is known as interoperative markings of the bone structures, interoperative mapping the knee joint. Once this mapping is done, then the surgeon moves aside. Then we give the final go to the robot. The robot is going to come and cut each and every cut very precisely. It is done under total supervision of the surgeon. The surgeon is there. Wherever he feels that something he's not happy with it, he can stop the robot, and we can again restart the entire process. Once this is all done, we wash the joint thoroughly, and we remove the small debris, and then we fix the implant with the help of bone cement. Then the standard closure of the knee joint is done, and the patient is rolled to the recovery room. After the surgery itself, on the same day of surgery, we tend to make the patient sit bedside. We tend to ask them to do some simple knee exercises. That is how we are not allowing the muscles to go into complete rest. If the muscles is not utilized for more than 24 hours, then it is going to tend to lose some strength. So we start utilizing the muscles so that they don't lose strength. And the next day itself, we make them stand and walk with the help of a walker support. What we have seen as compared to conventional knee replacement is that these patients are little less painful, and they tend to do their exercises very, 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 very well. And that is the main crux that we are finding the difference between a conventional knee replacement versus a robotic knee replacement.